Good afternoon. I'm Dr. Marilyn Howarth, um, and I'm talking with you from the Philadelphia Regional Center for Children's Environmental Health, an NIEHS-funded center um, to improve children's environmental health in our region. I'll also be joined today by Margaret Ferrandino, a climate change fellow working with us on our climate change work. This is the third in a series of webinars aimed at helping teachers incorporate climate change educational materials into their curriculum. And today's session will be on air quality impacts on public health in Philadelphia. Again, our purpose is to really explore climate change air pollution impacts specific to Philadelphia, really do a deep dive into this topic to enhance student and teacher understanding of climate change impacts on public health, and to hopefully give you some resources to use in the classroom. So how does climate change impact air quality? Well, greenhouse gases that you've heard a lot about have significant impact by increasing climate change effects. They themselves, carbon dioxide, methane, and other greenhouse gases, trap heat in the atmosphere. And this can cause, obviously, extreme heat episodes, but also changes in our normal wind and precipitation patterns, which can really significantly alter air pollution in a region. Smog in particular is an end product of these kinds of changes. So the greenhouse gases that are most common, carbon dioxide and methane, accumulate in the atmosphere and trap heat from radiating from the surface, and so creates higher temperatures at the ground level. Specifically, warmer temperatures accelerate a very important reaction of volatile organic chemicals and nitrogen oxides that are both air pollutants that come from other sources, but they together, in the presence of high temperature and sunlight, produce ozone. Ozone is a very important health impactful chemical at the ground level. Now, you may have heard of the ozone level in the stratosphere, at the highest levels of our atmosphere. And in that ozone level is protective. But when ozone forms at the ground level, it is very health impactful. It causes irritation of our mucous membranes and worsening of pulmonary conditions, in particular asthma. So where are these greenhouse emissions coming from? First of all, we know that transportation sources are large, account for a lot of greenhouse gases, as do the electric power industry. Any electric generation that uses fossil fuel generates these greenhouse gases. Industry remains another significant contributor to greenhouse gas formation. Methane, looking at methane specifically, of course, comes from natural gas and petroleum systems in our country, but also comes from municipal solid waste landfills. So where we take our trash really matters. Those landfills can be a significant contributor. Surprising to some people is the enteric fermentation, which is basically the gas that is created in animals. So cows and other large animals that ferment their food and produce these gases. Often they're coming out of their mouth and they can be quite substantial in some areas of the country, and actually represent 27% of all methane in terms of sources. So getting back to that ozone layer, we see ozone in the smog that we're often seeing in cities. And once again, it is the nitrogen oxides and the volatile organic chemicals. Nitrogen oxides really coming from all kinds of combustion, vehicles, coal-fired power plants, and other forms of combustion, even wildfires lead to some nitrogen oxide formation. And volatile organic compounds are really more the paints and pesticides and gasoline vapors that we have in our atmosphere. And these things both need to be present, these both categories, in order to form this ozone at the ground level. And we saw it form in smog in Houston after Hurricane Harvey. But in addition to forming ozone, nitrogen oxides and sulfur dioxide can form acids in the atmosphere. And these kinds of acid formations end up not just staying in the atmosphere, but actually raining down into lakes and onto surfaces and onto foliage. In the 1970s, we really deteriorated many of the forests in the Northeast as a result of the acid rain from the coal-fired power plants in the Midwest and Western Pennsylvania. And climate change also creates warmer, drier conditions for many of our forests, making them more flammable. Wildfires can create a massive amount of smoke, and we know that the particulates in the smoke carry along with them chemicals that can be really quite hazardous to people. And we know that these wildfire plumes of smoke travel really far. As you can see by this map from the National Oceanic and Atmospheric Association, wildfire smoke traveled from the Great Lakes region all the way through into the east, and over thousands of miles. And so when in Philadelphia in 2023, we saw the effects of the Canada wildfires in this intense smoke that we had throughout Philadelphia. We saw the EPA's air quality index go up to 425 to 500, which is truly hazardous, not just hazardous for unhealthy and sensitive populations, not just unhealthy for everyone, but truly hazardous. So this is the kind of circumstance that is hazardous to healthy people with no underlying conditions. And so coupled with the pre-existing baseline air pollution that cities like Philadelphia already have, where we are out of compliance with ozone based on the EPA's national ambient air quality standards, this is really very impactful. And so each of these episodes of very bad air pollution from wildfire smoke or other smoke can really lead to deaths and very significant health outcomes. And we know that in times of prolonged wildfires, such as experienced in the West, over much of the summer, there can be wildfires in many parts of Western states. We see how this smoke reaches all the way to the East Coast from the West Coast. And in general, the prevailing weather is, the prevailing wind is from west to east. And so it does tend to come in our direction. And really impactful to health over time. And so let's think about those excessive temperature and what that really does to our energy utilization. So as you can see on the left, this graph shows a 3-degree average increase in temperature in Philadelphia since 1970. Well, with that increasing temperature, we of course are using more energy to um, uh, power air conditioners and other food refrigeration, all kinds of other electric needs. And so where in Pennsylvania do we get our electricity? Our electricity, as you can see from the pie chart on the right, is largely from natural gas and coal, two very impactful energy sources on climate change. Natural gas from its greenhouse gas emissions, and coal from its otherwise very dirty emission profile, worsening air pollution in our region. And we see still 11.8% of the energy utilization is coming, energy generation is coming from coal in Pennsylvania. And this map showing on the left the US coal-powered deaths per state shows that how impacted Pennsylvania is in terms of the coal emissions. And it's not just coal emissions from coal that's used in Pennsylvania. It is the air that moves from Midwestern states where there are coal-fired power plants that move into Pennsylvania. And so Ohio, Indiana, Illinois, with coal-fired power plants and those emissions moving toward us in Pennsylvania, we have really the in the highest group of fatalities as a result of coal. And that's due to the emission profile of coal generation, which includes the sulfur dioxides and nitrogen oxides, both of which are extreme irritants to airways, particulates, which are associated with a whole variety of health impacts, such as dementia, heart disease, heart attacks, premature delivery. The heavy metals, mercury, cadmium, and lead, all of which have varying contributions to kidney disease, neurologic disorders, and other things. Radioactive particles, which are impactful to cancer generation, and other carcinogens, chemical carcinogens, all of these in coal emissions. And it's very hard to gather all of the health impacts of air pollution on one slide, but here are some of them. Increased bronchial hyperresponsiveness, in other words, airways that tend to want to contract. Increased airway inflammation. So inflammation making the airways smaller because of that increased inflammation. Decreased lung function in general. An increase in hospital admissions and ER visits for exacerbations of not only asthma, but other lung conditions. Increased hospital admissions for stroke and heart attacks. Increased risk for cancer, premature birth in infants, low birth weight in infants, and also increased risk for dementia. The more research we do, the more we find of health impacts due to air pollution. Let's look at asthma in a little bit more detail because it's so important to children in our region and so important in Philadelphia. The current asthma prevalence by state is broken out here into 5 different categories, and Pennsylvania and Ohio find themselves in the highest quintile. with rates of over 8.5%. This is really significant when we look at other areas of the country that can be as low as 4%. So really double some other areas in the country. Our our respiratory system is made up of a number of parts. We breathe in air through our nose, our nasal passages, and our mouth, and then it goes down the trachea into the bronchi, and then the bronchi break up into smaller tubes called bronchioles. And it's really in the bronchioles where asthma the asthma effects are seen. The bronchioles are wide open on the left, constricted in the middle, and constricted even more with mucus on the one on the right. And so why are children more susceptible to air pollution? Well, they breathe faster, they play outside and actually take more breaths, and so have a greater exposure to air pollutants. And so reducing any of these triggers, either from air pollution or other things, can really reduce the likelihood of an asthma flare. Let's look at all of the different things that can combine to worsen an asthma flare or cause an asthma flare. We talked already about air pollution, but if you have air pollution while you also maybe have pollen in the spring or fall or summer, or mold in particular in a wet season where there's just been flooding, or in the fall where we tend to have wetter climate with more mold. Perhaps people's homes have cockroach allergen that adds to the allergy response and adds to asthma. Perhaps they live with folks or visit family members or friends who are smokers. Pets in the home also are a trigger, and so are irritant cleaning products. Now imagine a child with asthma is exposed to some or all of these together. They are almost certainly, and certainly will have an exacerbation of their asthma, or is certainly an increased risk of having that happen. Air pollution has been named a known human carcinogen. And what's interesting about that designation is air pollution is really not one chemical, but rather a mix of chemicals, a mixture of things that together have been named air pollutants, known human carcinogens, because as they occur together, the various chemicals tend to perpetuate and propagate the effects of the others. And so polycyclic aromatic hydrocarbons, which are formed during combustion and are a common class of carcinogens in air pollution, make up a large number of these carcinogens, but there are others in air pollution. And so it is really important to recognize that not only does air pollution cause irritation, asthma, but also cancer. When we have these poor air quality days outside, the current guidance is to stay inside or go inside. And although there is some data currently that may not be perfect, it is better and it is often safer inside, especially if we're aware of how to keep the indoor environment as clean as possible and restrict the amount of pollution coming in from outside. So how do we do that? Often we think of really great air outside, wanting it to come inside. If we have clean air outside, we really want to keep the windows open, let the ambient air in, put a fan, and that would really be great. But when the air outside is poor, we want to restrict those entry points. And so we might want to restrict our air conditioner by making sure that it is on recirculate, keep windows closed, and also think about any opportunity for infiltration of air, such as through cracks and breaks in our the structure of our building. We also want to, on days with poor air pollution outside, we want to really minimize the number of sources that we make inside for air pollution. So it would not be a good day to really do a lot of indoor cleaning with harsh chemicals. And so we want to keep our air conditioner on recirculate, keep windows closed, and keep doors closed. We know that good ventilation, as we mentioned earlier, of outside air reduces the transmission of viruses, dilutes any chemicals that might be off-gassing from furnishings like carpeting and new chairs and couches and so forth. And also, good ventilation reduces the amount of carbon dioxide that we all exhale. So if you have a room filled with people for a long time, the amount of carbon dioxide in that room will increase unless you have good ventilation and you're changing out that air for cleaner air without that carbon dioxide. And so when the air quality is good, we want to increase that ventilation as much as possible. And so when we want to increase the ventilation, we can use an HVAC system if we have one. So if you just have windows, windows may be your best bet with a fan in them to bring air in. But if you have an HVAC system and it contains vents like ones you see right here, you want to keep the windows closed because that HVAC system is bringing in into your space air from the outside, but it's bringing it through a filter. So it is cleaning the air to some extent. And so increasing the ventilation rate to a rate of 21 cubic feet per person and a minimum of 5 air changes an hour is recommended to reduce airborne infectious disease transmission. And that kind of ventilation also will take particles and take chemicals and other air pollutants out of the air, not just viruses. And so using the highest quality filter that your ventilation system can tolerate is really the best approach. So using a MERV 13 filter to remove particles from the air is what is recommended by the CDC. Unfortunately, some systems can't take a MERV 13, and so you just use the highest MERV filter number that you can. The other consideration is the MERV filter itself is not going to take out all the particulate, and in some ways, some particulates are generated even within a classroom. So using an air purifier will also improve air quality by removing particulates as well. Air purifiers must be selected carefully for the space and occupancy, and they you need to understand the number of people in the room and also the size of the room in order to select the right one. The filtration is also something that needs to be considered. Some air purifiers have filters that need to be changed, and others have air filters that need to be washed. It's important to follow the manufacturer's instructions when handling that, because if the filter is dirty, it can't work anymore. So what can teachers do to keep children safe? They can know the air quality every day by signing up for air quality alerts at airnow.gov. They can also use the EPA Air Quality Flag Program in their school by flying a flag, whether it's outside or putting a small one on your bulletin board in school, to let children and others know what the air quality is that day, and tell parents about it as well. And more than knowing, it's knowing what to do when the air quality is not good. So when children, because children are by definition a sensitive group, when there's an orange air quality day, keep children inside on orange or red days. If it's a yellow day, going outside, especially in the morning, is a good plan. Teach parents about how to use the air quality too, and suggest to them that if it's an orange air quality day, that maybe it's a good day for children to stay inside after school. So on an air quality day with green or yellow, you want to increase the ventilation inside by opening windows or using the ventilation system. You want to have children play outside on those days. Cleaning is okay, but using safer choice products. Those are safer choice that are safer choice certified by EPA would be best. But when the air quality index is orange, red, or purple, not so much. You want to decrease outside air by closing the windows and doors and putting air conditioners on recirculate. Use fans for cooling instead. Use air purifiers on high, the high setting. Children should not play outside on these days. And you also want to minimize any cleaning products that are used while children are present. So I'd like to turn it over to my colleague Maggie Ferrandino, who will tell you a little bit about the teaching materials that we have available, where to find them, and how to use them. Maggie?
Hello. So as Marilyn mentioned at the beginning, part of our purpose today is to provide materials for you to use in your classroom to teach your students about the topics of air quality and climate change. We put together a document of different materials for you to use. And what I'll do now is I'll go over a few examples of the materials we found and then go over how to access that document. Next slide, please. So for elementary students, we found several resources, including videos, experiments, and flyers. The resource I have highlighted here on the slide is an activity book. The book features concepts related to air quality and will help students understand how air quality can influence their daily activities. The book includes fun activities like word searches, coloring, and connect the dots, along with more informative pages focused on reading and writing. This is a great resource for students to work on fun activities while still learning about the importance of air quality. Next slide, please. For middle school, one of the resources we suggest using is this activity provided by the American Lung Association. The resource provides guidance on presenting dilemmas to students for them to then discuss questions and solutions. An example of a dilemma would be something like, John has asthma, his family has 2 dogs and a cat, his house also has wall-to-wall carpeting in most rooms. What can John and his family do to keep his asthma from getting worse? The students are then able to discuss the dilemma and identify solutions to the challenges of air quality. Next slide, please. For high school students, one of the resources we are suggesting is the AirNow website. So AirNow is the website where you can check the air quality in your area every day, but the website also includes interactive maps, data, health resources, and educational resources. The website provides opportunities for students to use the interactive map daily to understand trends in poor air quality locations globally. Students can also apply different layers to the maps for ozone pollution and particulate matter pollution to look at specific pollutants in their area. Students are also able to analyze past data and identify trends in air quality in different cities around the US and the world. Overall, the AeroNow website just provides many opportunities for students to explore air quality in many different formats. Next slide, please. So this last slide is the document I mentioned earlier. We organized the materials by grade and then provided numerous resources for each level. We listed the type of material, a link to the material, a short description, and then some suggestions for use in the classroom. Obviously, you, the teachers, are experts in actually teaching, but we just wanted to make your lives a little bit easier by brainstorming some ideas on how to use the materials. We'll provide you with a link to a public folder labeled teaching materials, and you'll have access to these and many more resources to help teach the topic of climate change. Thank you.
Well, thanks, Maggie. I wanted to make sure that everyone knew that we were available for other kinds of discussions and consultations. Please don't hesitate to reach out to us at the Philadelphia Regional Center for Children's Environmental Health. We cover on our website a number of other topics that may be of interest to you and useful in your classroom. We have other materials there. We urge you to follow us on social media, and also again take a look at our website. Thank you very much, and good luck with your activities.